Today let's study about the topic necrosis. So necrosis is nothing but a form of cell death. It's a form of cell death in which the cellular constituents or the components leak out of the cell membrane. It elicits a local host reaction called as inflammation. So it's a pathological cell death which is associated with the inflammation. So talking about its microscopy, we see that it has amorphous appearance, that is the one which has no morphology, and this is due to the leaking out of all the cellular components out of the cell and the digestion of the cell. The first one is amorphous appearance, the second one is eosinophilic appearance, that is it appears pinkish in color. This is because there is no nuclear material seen and hence it is completely pink in color. And the third one is we can see some inflammatory cells there as it is associated with inflammation. So this is the microscopy. Now, based on the morphological patterns of the tissue, we will study about the types of necrosis. So, types of necrosis based on morphological pattern of the tissue. So, we can remember this, the mnemonic as C cube F square G. So the first one being the coagulative necrosis. Second one is liquefactive or also called as polyquative. Third one is gangrenous necrosis, which is the combination of coagulative and liquefactive. The next is caseous necrosis. Next one is fat necrosis, and the last one is fibrinoid necrosis. So these are the types of necrosis based on the morphological pattern of the tissue. So now let's study one by one. So coagulative necrosis. When we talk about the coagulative necrosis, the hallmark of this type of necrosis is the presence of ghost cells or tombstone appearance. The ghost cells have proper architecture maintained. So in this type of necrosis, it is caused due to ischemia. The ischemia causes cell injury. The cell injury causes the cellular proteins to get denatured, and this causes the loss of cytoplasmic and nuclear material. But the thing to note here is the architecture of the cell is maintained. And about the microscopy, in gross appearance, we see wedge-shaped infarct, and we see ghost cells or tombstone-like appearance. And the site of this type of necrosis is most commonly in the heart, second is kidney, third is liver, and it can also be seen in the skeletal muscle. So the Xenithus degeneration is an example of coagulative necrosis. It is the coagulative necrosis of skeletal muscle. It's the complication of typhoid fever. And this is seen in skeletal muscles such as rectus abdominis. Liquefactive necrosis. So the first type of necrosis was seen in solid organs, and this type of necrosis causes melting, that is liquefaction of the organs. This is caused by the hydrolytic enzymes released by the neutrophils. So in this this type of necrosis, the hallmark of this type of necrosis is pus formation, pus or liquid formation. And here the mechanism is due to the release of hydrolytic enzymes by the neutrophils. There is enzymatic digestion of dead cells. So when there is enzymatic digestion, these dead cells are completely liquefied. And when these get liquefied, there is liquid formation seen or fluid filled cyst cavity seen in the case of brain infarct. And the site of this type of necrosis, this is exceptional, that is the brain and pancreas. Here both these organs are solid organs, and that's why this is the exceptional case. And in brain, if there is a stroke, we see the liquefactive necrosis. And in pancreas, whenever there is acute pancreatitis, we see liquefactive necrosis. When we talk about the microscopy, here due to liquefaction, the tissue architecture is completely disrupted. So this was all about the third type of necrosis, that is gangrenous necrosis. Gangrenous necrosis is the combination of coagulative and liquefactive necrosis. Here a lot of coagulative necrosis and a bit of liquefactive necrosis. So the gangrenous necrosis is of two types, that is dry gangrene and wet gangrene. So let's see the difference between the dry gangrene and the wet gangrene. So in dry, no pus, no swelling, but in wet there is pus formation, and here there is severe ischemia without infection. Here, along with ischemia, we see secondary infection. The third point, here we see clear demarcation line between the healthy tissue and the diseased one. Here there is no clear demarcation seen. So the next point here is that this is caused by chronic arterial occlusion. And the pathology of this is coagulative necrosis. And here we see dry black shrunken mummified tissue, whereas here we see greenish black appearance. Moist, foul smelling tissue is seen, and blisters and pus discharge. Pathology here is the liquefactive necrosis. The systemic features are fever, toxicity, and sepsis risk. So next, noma. It's basically a gangrenous stomatitis. So consider an immunocompromised person or a malnourished African child. So they have Fusobacterium spirochetes in their oral cavity normally, but these here cause an infection. This causes gum lesion. Gum lesion causes edema. Edema causes necrosis. Necrosis causes gangrene. And the mortality rate is about 70 to 90%. So now let's move on to the caseous necrosis. That is the next type of necrosis. So the caseous necrosis. Caseous meaning cheese-like. So what we studied just now was gangrenous necrosis, which was a combination of the coagulative necrosis and the liquefactive necrosis. Now here, what we see is the combination of coagulative necrosis, liquefactive necrosis, plus the lipid content. This forms cheese-like material. So here, the caseous necrosis is caused by an infection of TB, maybe an infection of syphilis, it may be an infection of fungus. In fungus, it may be of histoplasma and cocciditis. So in microscopy here, we see amorphous appearance. We see some epithelioid cells. Fat necrosis. So the hallmark of fat necrosis is the calcium deposition. Just imagine if all the fat is lost in the body, what we see is the bone, and the bone contains calcium. This is not scientific, just remember. And so here the hallmark is calcium deposits. So the mechanism here is obviously the fat breakdown. Fatty acids plus calcium. The calcium which has chalky white appearance, and these fats have the property of saponification of fats. Fatty acids have the property of saponification of fats, which means they attract the calcium. Hence, there are calcium deposits seen in this fat necrosis. The sites. First is breast in the case of trauma, and the second is peripancreatic fat necrosis. Fibrin-like. So this is seen due to blood vessel damage. It may be due to systemic hypertension, or it may be due to antigen antibody complex which gets settled. So blood vessel damage, that is in the case of vasculitis. The systemic hypertension, that is due to because of increased blood pressure, and whenever there is antigen, antibody comes and binds to the antigen and forms a complex of antigen antibody complex, and if this complex is not phagocytosed somehow, it will get settled in the blood vessel. So when it gets settled in the blood vessel, the neutrophils come and try to eat this complex but end up harming the blood vessels too. So that's why they call the blood vessel damage. And the sites of this type of necrosis is, first one, that is malignant systemic hypertension. Second one is polyarteritis nodosa. Polyarteritis. Third one is rheumatic heart disease. Fourth one is SLE, that is systemic lupus erythematosus. And the microscopy here is bright pink smudgy amorphous deposit. So this was all about the topic